CAHN Health Hour with Black GPs and senior consultants giving Black health advice, improving Black health equality. CAHN Health Hour.
Good morning, everybody, and welcome to another Saturday edition of the Health Hour. I'd say 18 months ago, when we first went into our first lockdown, I don't think any of us thought that 18 months later we'd be in this position where we're talking about COVID. Well, first of all, that we're still talking about it. Secondly, that it's still an issue. And I think the situation now is that it's moved from a pandemic to becoming endemic. But I think many of us still have the same questions. And in fact, this week, the questions have become even more important because we're now talking about boosters. We're talking about whether children should have the vaccine. So I'm delighted to invite an expert from public health, Dr. Cordelle Ofori, who's going to talk to us today and perhaps help to answer some of those questions and concerns that people still have. If you're on our WhatsApp forum, a link was shared with frequently asked questions that may have helped to address some of your issues. I always find that it's really helpful to be able to put questions to people because providing you with answers in context is really important. So I'm going to hand over to Cordelle and looking forward to the session. Thank you, Cordelle.
Hi. Hello, good morning, everybody. So I am Dr. Cordelle Ofori. I'm a public health doctor in Manchester. So I work both for the NHS, Manchester Health and Care Commissioning, and I also work for Manchester City Council as well. And for the past year and a half, the vast majority of my time has been spent in working on and managing the COVID-19 pandemic. But a long time ago, I did used to be a GP. And one of the reasons why I moved from doing general practice to focusing on public health was because of something that we're hearing a lot about now called health inequalities. And basically that's the phenomenon that describes the difference between the health outcomes of some people. So some people have better health than others for reasons that can be prevented. So some people's poorer health is because of the area they're born in, or because they have less money, or because of the type of education they've had, or as COVID has really shown over the past year and a half, because of their race or their ethnic background or their country of origin. And one of the things that COVID has really shown, which was there before but has become more obvious over the past year, is that in this country, people of African and Caribbean, as well as Asian and other ethnic backgrounds, often have poorer health than white English people do. And that's something that myself, alongside CAHN and lots of other people, are really, really passionate about doing something about. That's a bit about me and why I do what I do. And as Dr. Ngozi has said, it's been a really, really tough, I say tough year, it's not even a year anymore. It's been a tough year and a half, getting on for 2 years. And most of us would never have imagined that we would still be in this position. So I think on the bright side, even though lots of people are still getting COVID, so if I think about the case rates in Manchester, which is where I work, so that's the city of Manchester rather than Greater Manchester, at the moment, we're still getting about 250 cases a day. And if you compare that to December, when we were still in a lockdown, back in December, it was around 150 cases a day. So lots of people are still getting COVID. But the difference now is, because so many people have had the vaccine, the number of people who get it really badly and the number of people who die if they get it isn't as bad as it was before. So that's the positive news, and that means we can see a bit of light at the end of the tunnel, even though COVID is something that's going to be with us for the foreseeable future, and we're all going to have to learn to live with it. to a certain extent. So you've asked me here today to speak a little bit about the vaccine. So if I say a little bit first about where we are now in terms of the vaccination programme. So up until relatively recently, everybody was offered 2 doses of the vaccine. So in order to be fully vaccinated and be as strongly protected against COVID-19 as possible, you needed to have 2 doses 8 weeks apart. And at the moment, the national picture, so for people everywhere in the country, over 80% of people are now fully vaccinated. So that's adults over the age of 18. They've had both their doses and they're fully vaccinated against COVID-19. And in terms of just having the first dose, it's even higher. So almost 90% of people now in the whole country have had their first dose of the vaccine. Unfortunately, that picture is different in different parts of the country. So if we look at the figures for Manchester, in Manchester, only 2/3, that's 60% of people are fully vaccinated and have had both doses. So that means we've got 40% of people in Manchester still aren't fully vaccinated. And so you'll hear about community immunity or herd immunity, which is that concept where the more people that have the vaccine, the more protected we all are. In Manchester, compared to the rest of the country, we're not as well protected as a population or as a community as people in other parts of the country are. And in terms of the first dose, it's 66% of people. We're also able to look at the data for people of different ethnic groups only if their ethnicity is recorded in their GP record. So for people that have their ethnicity recorded in their GP record, we know that over 17,000 people who would tick the Black African box when they're recording their ethnicity in Manchester have had their first dose, which is really, really good. Still not as high as it needs to be, but it's really good. And for Caribbean people, less people are likely to have their ethnicity recorded. So we don't have that many people's ethnicity recorded in GP records. But for those that do, about 4,000 people have had the vaccine, which is good. And in terms of side effects, for the large majority of people, it's that common side effect of feeling a bit rough, unwell, under the weather for a couple of days after you've had the vaccine, 2 to 3 days, and then they feel better after that. So in terms of, one of the things I guess I wanted to say today was, as a public health doctor, so as a professional working in Manchester, what are the things that I think are really the most important things to keep us all safe and well as we're heading into the winter months? And even though things are better than they were in some ways last year, unfortunately, the hospitals are under a lot of pressure because it's not just COVID now. Last year, when we were all staying at home most of the time, not going out as much, working from home if you can, shops were closed, restaurants were closed, that kind of thing. It meant that it was more difficult for other viruses, so other respiratory viruses that we usually see in winter, to spread. This year, we're all out and about again. So all of those viruses that we usually see are out and about. And not only that, we've all become a little bit less immune to them. So we're seeing more of them and earlier of them than usual. So that means the hospitals are under a lot of pressure. And I'm sure there'll be some of you already who you may yourselves, or you may have family or friends who've had to go to A&E or go to a hospital in recent times, and you'll know just how hard it is, how long people are having to wait to get seen to and that kind of thing. And unfortunately, that is probably going to get worse before it gets better. So it's really important that we all keep ourselves as well as we possibly can over the winter. So from a vaccination point of view, the things that I'm concerned about for the population of Manchester. So my first one would be people who are over the age of 50 who aren't fully vaccinated yet. So anyone who's aged over 50 who's either not had their first dose or not had their second dose, those are the people that I'd be really concerned about, because they're the people who are most likely to get COVID badly. And in Manchester particularly, we still have lots of those people in that age group, particularly Black people of either African or Caribbean or mixed Black and other backgrounds, who still haven't had their first dose yet. And that's really, really important. My second would be people who are fully vaccinated. They have had both doses, but they were over 6 months ago. So you would have heard this week the announcements that there's going to be a booster. And the reason for the booster is that we've started to see that after 6 months, that immunity that you get against COVID, that you get from the vaccination, starts to wane. So it starts to weaken. So we've started to see in some of our care homes, older people who, the care homes who were seeing much, much less COVID than they were last year. We've started to see people getting COVID again. And that's because it's such a long time ago since they had their 2 doses of the vaccine, that the immunity is starting to weaken a bit. So those people, anybody over the age of 50 for whom it's been more than 6 months since they had their second dose, when they get offered that booster, it's a really good idea for them to have it. The next group of people I'm concerned about are pregnant women. So this is a difficult one because COVID is a new disease. So the science is evolving. We're learning more and more about it every day, every week, and every month, and things change. So when the vaccination program first came out, it hadn't been tested in enough pregnant women for us to understand what the kind of pros and cons were for giving the vaccine in pregnant women. So at that point, it wasn't being recommended to pregnant women. However, lots of months have passed since then. And unfortunately, what we have started to see is women who get COVID in the 3rd trimester of their pregnancy, so that last stage of pregnancy, getting COVID then is really not a good thing. Really sadly, we're seeing women getting really, really sick. Some women, their babies get very sick as well. Their babies have needed special care. And in the worst case scenario, some women have died and left their babies behind, and we've seen stillbirths as well, which is really tragic. The positive news is that lots of pregnant women in other countries have had the vaccine, and we've been able to see that actually it is safe. And so one of the things that I'm really concerned for now is for pregnant women to get that vaccine before they get to the last stage of pregnancy. I know how hard that is when 6 months ago, it wasn't a recommendation. And so people will be thinking, oh no, I'm concerned about my unborn baby. Should I be doing this? What could happen? And I know it's a really, really difficult decision to make. But from what I know in terms of what's happening to pregnant women when they do get COVID at that stage of pregnancy, getting COVID when you're pregnant near the time that you're going to have your baby is worse than having the vaccine. So I would really, really recommend and encourage people to get it. And then the final group of people that I'd be most concerned about are children between the ages of 12 and 15 who are most at risk. So those are the children who have got some kind of really severe health condition. Maybe they're on chemotherapy, they're immunosuppressed for some reason. If you're a parent of a child like that, you would know. And those children, again, they're the children who are more vulnerable, more likely to get very, very ill when they get COVID. Most children, if they get COVID, won't get seriously ill, but children with these underlying conditions might. And so for those children, again, those are the children that I'm most concerned about. So I guess I'm saying all of that to say that as a public health doctor, from a priorities in terms of making sure that people stay as well as they can, those are the things that I am most concerned about. So those are the people who are most likely to get unwell if they get COVID. So I'll just say a few other things that I know that are commonly asked things, and then I'll stop and take any questions. So I think the question that still gets asked, even though the vaccine has still been around for a while, is, does it work? And in a way, that's not really a yes or no question answer. But if I was going to say yes or no, then I would say, yes, it does work in terms of the main reason why we're giving it. And the main reason why we're giving the vaccine is to stop people getting it badly, to stop people dying from COVID. Those are the big reasons, and also to stop it spreading as much. So just to give you a figure, which is something that just came out over the past couple of weeks, because they count and track people who die from COVID-19. So between January and July, in this country, over 51,000 people died from a COVID-related death. 51,000 people. Out of all of those people, only about 600 of them had been fully vaccinated. And some of those fully vaccinated people actually caught COVID before they got the vaccine. So what that says to me is, okay, the vaccine isn't perfect. So we know that. Everybody now will know somebody who's had both their vaccines, but still got COVID. And unfortunately, some people have had their vaccines and still ended up in hospital. So it's not perfect. Some people will still get it. But what we do know is that in terms of your chances of getting it, you're much, 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 much less likely to get it badly if you're fully vaccinated than if you aren't. And there's really no comparison between the numbers of people who get it badly who are fully vaccinated compared to those who aren't. So yes, it does work, but it's not perfect, is the message. And then finally, I think the other question that people will probably be asking is about children. So as we know, this week it was announced that children between the ages of 12 and 15 are going to be offered the vaccine. And that's going to be at school. So in the same way that other childhood immunisations for school-age children are given in school, the vaccine will be offered to children at school. I know most of you would have also heard that the JCVI, so that's the body of scientists and experts who make recommendations as to what we should do with vaccinations, hadn't recommended that we give the vaccine to 12 to 15-year-olds just yet. So I'll just explain that a little bit before stopping to take any questions. So basically, what they're looking at is, when you're giving the vaccination to a whole group of people, what are the benefits and what are the risks? And they're kind of weighing it up to come to a decision and to make a recommendation. And we know that the younger that you get, the less a risk COVID is to you. So for very, very young children, most young children either won't get symptoms at all or will get mild symptoms. And the older you get, the more likely you are to get very, very sick with it. So the first thing they're looking at is actually, for young children, the risk to their health from catching COVID isn't as severe as it is to adults. And then they'll be thinking, okay, well, what are the benefits? So the benefits are, it's less likely to spread amongst them. It's less likely to spread to other people. They're less likely to catch it at all. And that means you're going to have healthy children staying in school, less outbreaks, less school closures, less classes being sent home, and children are able to stay in school and maintain their education in a way that didn't happen last year when we had so much disruption. So when they've weighed up the benefits and the risks, they think that the benefits are more than the risks, but it's only slight. So the wording that they used, for anybody who kind of read any reports or watches the news, you'd have heard them use the word marginal, which means that it's a bit better, but it's only slightly better. So when they weighed it up, they thought, well, the benefits are only slightly better. So we think at this time, we're not going to recommend it. what the chief medical officer has then gone on to do has been to take this recommendation for the experts, but then also think about the country as a whole, the situation that we're all in, and make a final recommendation to the government as to whether they think the vaccine should therefore be offered to children of that age group or not. And so what they've done is they've weighed all of that up, and they think they should still carry on and offer it to children so that children and schools can get that benefit, even if the benefit is only slight. They think it's something that's worth doing. So between this week and half term, all children of that secondary school age will get the offer of a vaccine. And it is a choice between the parents and the child as to whether they go ahead and have it or not. But that offer will be there. So I think I've talked quite a bit now, so I'll stop now and take any questions. Thank you.
Well, thank you very much, Cordelle. That was really interesting and very, very clear and succinct. And I think you've clarified a lot of the issues that people may have questions about. So I do have a few questions in the chat box that people have put. And one of them I think you have addressed, but because it came towards the end of your talk, I think perhaps this person would like slightly more clarity. They are concerned about people who have had the double vaccine, who are still able to pass on COVID. And they're concerned about, I think they haven't said this, but I do wonder, they said that they've been double vaccinated, they've passed it on, and the people they've passed it on to have died. So I wonder, although they haven't put this, whether the people who have caught it have been unvaccinated.
Right, yeah. So I guess, as I said, it's not perfect. So in terms of all of the things that it's supposed to do, occasionally there will be an incident where it doesn't work as it's supposed to. So it is possible for somebody to be fully vaccinated and pass it on, even though it's less likely. That's the first thing. In terms of the person that they've then passed it on to, if that person got COVID so badly that unfortunately they've died, and I'm really sorry to hear that, obviously I don't know that person's personal situation, so I don't know the circumstances, but generally now, when people get it so badly that they die, they're either not vaccinated at all, or perhaps they've only had one dose, or if it's a situation where they have been vaccinated and they were vaccinated long enough ago for it to have worked, so they had their 2 doses more than 2 weeks ago. Usually it's people that have got other things going on. So they've got other conditions and there are other things that were already wrong with them that has meant that they're more likely to become seriously ill and unfortunately pass away. It would be very, very, very unusual for somebody who was completely fit and healthy, no problems, no health problems, nothing else going on, and then had 2 vaccinations to get COVID so badly that they would die. That would be highly unusual. So I suspect it would be that something else was going on or they hadn't had their vaccinated, but obviously I don't know what that person's actual situation was.
Thank you, Cordelle. You said when you were talking that within the country that about 80% of people have had 2 doses, but within Greater Manchester, that is just 60%, which is a bit of a concern. Now, when you look at Manchester and you split it out into different areas, are there particular areas that are more at risk?
Yeah, so there are areas that have got lower coverage than others, but on the whole, the link is a combination of either age-related, so younger people are less likely to be vaccinated. So young people, regardless of what ethnic background they are, on the whole, the younger you are, the less likely you are to have gone and had your vaccine for a whole range of reasons. So that means if we look at the map of Manchester, sometimes we use colours to show where vaccines uptake is high and where it's lower. And the colours where it's lower, which we often mark in red, tends to be the areas where we're seeing more younger people living. So that's one thing, like young adults living, students, that sort of thing. The other thing which I've already mentioned is ethnic background and like people's country of origin. So on the whole, African and Caribbean people are much less likely to have had both their vaccines than anyone else, but there are some other ethnic groups as well. So Arab people as well are also less likely to have had their vaccine in Manchester, while some of the other ethnic groups where there were concerns at the beginning, people have seemed to have built their confidence and changed their minds. So, for example, Pakistani and Bangladeshi people, it was a similar picture earlier in the year, but much more of them have now gone forward to have their vaccine. So because of that, areas where you're more likely to see African or Caribbean people living also, or not just that, areas where generally we have lots of people who are from other parts of living in the world, like the central bit of Manchester, generally vaccine coverage is a bit lower there. And then the other thing which often gets forgotten in kind of the national and the media and the press and things is we have lots of people in Manchester who have lots of challenges in their lives and they just have a lot going on. And if you have a very difficult social circumstances, maybe, people who are living in hostels or bed and breakfast because they're homeless, people who have substance misuse or some types of addictions, all sorts of things, mental health problems. When you mix all of those things together, actually, even if you want the vaccine, it's not going to be your biggest priority, and it's going to be hard for you to actually access it and get it. And we have more people whose lives are challenging, if you like, in Manchester than they do in other parts of the country. And that's another reason why our vaccine coverage tends to be a bit lower than it is in other parts of the country.
Thank you for that. We've got a number of questions related to the immunity of the vaccine and the need for a booster dose.
Yeah.
So I'll put them all together. One is about how sure are we that we absolutely need a booster, and why is it 6 months? Are there any differences between what booster you received depending on what vaccine you had initially? So if you had the Pfizer, should your booster be with Pfizer? And vice versa with the other ones. And I think the last question in boosters is, if we have a booster now, will we still need one in the future? Is the immunity cumulative? So a third booster, will that mean that that's it? Or do you expect that in 6 months' time we'll need another booster as well?
Thanks. So all of this is based on what we know about COVID now and what we know about the vaccines now. And there are some things that we will learn about and we will gather the knowledge about over the next year, 2 years, 3 years. But based on what we know now, it looks like people's immunity, so all of the antibodies that your body has produced to attack the vaccine if you get exposed to it, if you come across it, to stop you catching it and becoming unwell, that starts to go down around the 6 month mark. So that's the studies and the research that they have been doing, which is why it took a while for them to make the final decision, because they were waiting to get the results from the trials, the research studies. And it looks like 6 months is around the time where you don't have enough of that immunity anymore and you're going to need a boost. So that's the reason for the 6 month recommendation. And what they'll do is they'll offer it in order of, so the people who had it the longest time ago, if you like, will get it first, and then they'll move through like that. And also the people who are most at risk will get it first. In terms of the type of vaccine, the recommendation is that it's Pfizer, regardless of what you had the first time. So the booster that people will be offered will be the Pfizer vaccine, not AstraZeneca, and that will just be the booster, regardless of which one you had the first time. In terms of what happens in the future, we don't know absolutely for sure yet when or how it will work, but I think older people will almost definitely need to have some form of booster again in the future, in the same way that people who have a flu vaccine have to have it every year. people who need a pneumococcal vaccine have to have it every few years. And there are other vaccines where, depending on how the vaccine works, you need it more than once at different intervals in the future. So I think it's highly likely that we will need boosters again. But what we don't know yet is how often that will be and how many times in the future that will be. But definitely for older people who are more at risk of becoming unwell with it, I'm sure there will be some kind of booster program again, but we don't know yet what that will look like, because they're still studying it and we're still learning about how the vaccine and the virus works. So we'll have to see. Have I answered all of the
Yes, you have. Thank you. Now, there's another question about it's interplay between, someone said, I know I'm going to get the booster, they have to get it. We also want the flu vaccine this year as well, because you did mention that you're seeing other viruses on the increase now. I think the social distancing measures that we've been undertaking the last few months have meant that the viruses that we usually saw in winter, we didn't see that influx, and now we seem to be seeing more viruses. So the question this person has is, do I need an interval between the flu and my booster? If I'm called for both on the same day, can I have both of them on the same day?
Yeah, so that's another reason why it took time for them to make the recommendation, because they were also waiting the results of the studies to work out whether it's a good idea to give them both together or not. And what they've shown is that actually you can give them both together. So if you do get offered them both at the same time, you can, and you feel happy doing that, the science has shown that it's fine, and it is fine to offer them both together. And actually for people who have it later in the year, they probably will be offered them both together, just because it's easier then in terms of managing people's appointments and things to just get both done at the same time. The viruses work in different ways, so it was unlikely that it was going to be a problem, but obviously they had to do the checks and the studies and things first to be sure about that. So yes, you can have them both at the same time, but at the same time, if you do get offered them separately, so some people are already getting offered their flu vaccine now before they've been offered the booster, I would just go and get your flu when you're offered it, and then whenever you're offered the booster, go and get it then. I wouldn't wait just so that you can have them both at the same time. Just get it as soon as you have the opportunity to.
Thank you. There are a number of questions related to children, and I think anytime there is sort of conflict in information that comes out, it causes concerns, and I can understand those concerns. So these are problems with giving a vaccine to a healthy population, where the prevailing understanding is that even if they do get COVID, they don't get it. It's quite mild. So I know you gave you gave a really good explanation for that, but I think there are still some concerns. So one of the concerns is you don't want your child to have it. They go into school and they give their consent as a 12-year-old. Can they still be given the vaccine in that situation?
Yeah, so this is one of the most difficult situations that we're going to have with this. So first of all, I just want to say that everybody who is concerned about it, I completely understand. And these are really, really, they're hard decisions for the people who make the recommendations to make. Any decision about a vaccination programme is always hard, because on the whole, the people that you're giving this to are healthy. And so you're having to work out whether it is worth giving a healthy person something or not, and what the risks and the benefits are. And then when you consider that in children, it becomes an even more difficult decision for everybody, and then even more so for parents. So I really do understand why people are concerned about it. So the consent issue, so I don't think this has been fully worked out yet. And now they've made the final decision that they definitely are going to offer it to 12 to 15-year-olds. The practicalities of how they will work out the consent are now being thought through. So I can comment on the principle rather than how it will actually work in practice. And I think the first thing to say is that in practice, the way in which we always do things is to ask for parental consent. And in the large majority of cases, you get parental consent, and whatever the parent says is what goes. It's really highly unusual, especially for 12, 13-year-olds rather than 15, 16-year-olds, for their parents to give consent either one way or another, and then for the young person to disagree. It does happen, but it's not a common thing. Obviously, we haven't done it with COVID yet, so it might turn out to be different and I'll be wrong, but I'd be surprised if that was the case. So I think that's the first thing, to just reassure people that on the whole, the first thing we always do is ask for parental consent, and that usually ends up being a decision that holds weight. Saying that, as we have all heard, and as there is precedent for in other situations, there may be a situation in which a young person has made a decision for themselves, which isn't in agreement with what their parents have done. So in that, when that situation happens in normal kind of clinical practice, so what I was trained to do as a GP, if that happens when a young person wants something clinical that their parent doesn't agree with, then he has to have a conversation with that young person and work out a few things. So do you think that they completely understand the condition and the situation? Do they understand the treatment that is being offered, what it is and what it's for? Do they understand the advantages or the benefits of receiving that treatment? And do they understand the risks or the disadvantages or the side effects of having that treatment? And if you have a conversation with that young person and you are satisfied that they do understand all of those things, you may have heard people talking about Gillick competence or following the Fraser guidance, and that's what that's about. If you're confident that the young person can understand all of those things and therefore is able to make a decision in the same way that an adult can make a decision, then the principle is that you should allow that young person to make that decision for themselves. And therefore, if they do want the treatment, they can have it. So that's the principle by which a young person could decide to have the vaccine, even if their parent hasn't. In practice, that's actually not going to be that straightforward, because it's not a young person going to see a GP and having their 10-minute consultation and being able to have that conversation, because in practice, the vaccine is going to be offered in school. And so in reality, I think it's highly unlikely that on the day that the vaccine's being given, children will be given the vaccine when their parent hasn't given consent, because that whole judging whether they're competent enough to make a decision takes a bit of time. And so the schools and the school health services that are offering the vaccine are going to have to work out some kind of practical way for the children who say one thing where their parents say another, how are they going to assess the child to make that decision and therefore offer the vaccine? And that's the bit that hasn't been worked out yet. And I suspect in reality, what may happen is they don't get the vaccine the first time round if their parent has said no. And then they end up having to have some kind of separate conversation or assessment. And at that point, maybe it's their GP who then decides, yes, I think they can make a decision for themselves. And then they get the vaccine in another way. But it's quite complex, and they haven't worked out exactly how that's going to work yet. But that's the kind of principle behind it.
Thank you. I think there's some parents who've been concerned that maybe, you're standing in the line for your vaccine and everybody else is doing it, and there's a bit of peer pressure when they're against the vaccine. So I think it's quite reassuring for parents out there who there's a discordance between their views and their child's views, that there will be a conversation. It won't be that you just end up standing in the line because everybody else is doing it and then they get given the vaccine.
Absolutely. I mean, that would be unethical and bad clinical practice. You wouldn't be able to just have a child standing in line, their friends say, I'm having it, and so they decide to have it when their parents say no, and you just give it to them. You can't do that. You have to assess the situation properly.
Yeah, I think it's useful that we're having this conversation, because I know out there that there's a lot of misinformation.
Yeah.
And so when the Sky News says children will be able to make their own decisions, what parents visualize is that I'll have given my views and school will just go ahead when my 12-year-old, who can't decide what she needs for breakfast, can now make a decision about a vaccine. So, I think it's very reassuring.
Yeah.
And
the school can't make that decision either. I mean, I think that's a really good example, because this is a judgment that has to be made. So I don't think the school would be able to decide. It would have to be, it's the people who are clinically responsible for offering the vaccine who would be responsible for making that decision, and that's not the school.
Okay, thank you. There's a question here still with the 12-year-olds, and you've pointed out that there's a group of 12 to 15-year-olds that you would absolutely recommend the vaccine. So if you're immunocompromised or you have underlying health issues. There's someone here asking about, if you're less than 12 and you have these underlying conditions, with the vaccine, are there any recommendations for vaccines in younger children?
So then, I mean, now you're getting into a very specialised area. So it really is on a case-by-case basis. So there is no general recommendation. It's if you have a child who has some form of really rare condition that puts them at risk, whichever clinician is responsible for your child's care can have a discussion with you about the pros and cons of having the vaccine, and they would either recommend to you or help you decide whether it's a good idea for your child to have it or not. So if you do have a child who has some kind of illness whereby you're concerned and you think, maybe my child should be having the vaccine, or you want to have a conversation with it, that's a situation where you should either talk to your child's GP, or if they're under some kind of specialist, have a conversation with that specialist. Thank you.
There's another question here. I think you may have covered this, but I think it comes up quite a lot. But it's about, if I've had COVID, do I still need to get the vaccine?
Yes, you absolutely still need to get the vaccine. So if you've had it very recently, we say you should wait 28 days from when your symptoms started before having the vaccine. But once that time has passed, you should have the vaccine. And that's because, as we all know, and you can get COVID again once you've had it once, the immunity that you get from COVID doesn't last forever. So you need the vaccine to actually boost your immunity, to protect yourself from getting it again, and also to reduce the chances of you passing it on to other people. And one of the things the studies have shown is that actually for people who've had COVID before, having the vaccine really boosts their immunity, so you can have a really, really good, strong immune response and good protection if you have the vaccination when you've had COVID in the past.
Thank you. You did talk about the situation with pregnant women, and if there are anybody here who's listening or who has family members or friends that are pregnant, please, if you could encourage them to think about taking the vaccine. So if they do, as a sort of special group, especially because the information that came out at the beginning of the vaccinations was not very clear because there wasn't enough information. Now that information is much, much clearer. And some of you may know I'm a neonatologist. That means I look after premature and sick babies. And we are seeing more babies admitted because their mums, they've had to come early because their mums have now developed COVID vaccine and they're really, really poorly. And so that's having an impact on the care I provide to babies as well. So if you do, are there any special arrangements for vaccinating pregnant women? Where should they go? Is it their normal maternity clinic? Is there a GP? Where do they go to get vaccinated if they want to?
So in Manchester, women who are booked to have their babies with Manchester Foundation Trust, that covers the kind of main Manchester hospitals. they are running vaccination clinics specifically for pregnant women. So your midwife, or the maternity service should be able to tell you about those. If you're pregnant and you're booked in with a Manchester hospital, I would be surprised if you haven't heard about it, because they're really, really making a big effort now to make sure that all pregnant women know that they should have the vaccine, and they're putting on special clinics for them to have it. So it would be through the hospital rather than through your GP that you would get the vaccine. And the other thing that they're doing is reducing the time between the first dose and the second dose. So rather than waiting for 8 weeks, you can have it 4 weeks, at 4 weeks instead. And that's just to make sure that you're fully vaccinated before you get to that last stage of pregnancy, which is the time that's that risky period.
I've had a few questions come up again about children, and there are people who are asking the question that my child has never had symptoms of COVID, they've never caught COVID, they're really well, why should they have the vaccine?
So I think the things to think about is out of all children, the children who are most likely to get it are teenagers, which is why they've been looking at this group specifically. So, you know, I was looking at our case rates in Manchester just before I came onto the call, and still the highest rates out of every age group are in teenagers, because they're back in school now. They mix a lot. They're going in and out of different classrooms for different subjects. They mix outside school as well. So there's a lot of mixing, and they're more susceptible to it than very, very young, like primary school age children. So for all of those reasons, they're more likely to get it. And as anybody who's either got teenage children or knows people with teenage children, before the summer, they were in and out of school because of somebody gets COVID, it spreads, and then they have to close, they have to be sent home, they have to isolate and all of that kind of thing. And it causes a lot of disruption. And even now the rules have changed. If there were an outbreak in a school, so lots and lots of children got COVID, they would still need to isolate. We would still need to either close classes, or in the very worst case scenario, the school might have to close. There's also the health of the teachers as well, in terms of the teachers getting COVID. So it's for all of those reasons that the vaccine's being recommended. But I think the thing that makes this decision for anybody as a parent hard is that really it is a decision that is as much about the wider community, so the wider school community, if you like, as it is about the health of your own child. And in fact, you could argue that it is more a decision about the wider community than the health of your own child. Because on the whole, if you've got a very healthy, well child, most healthy, well children between the ages of 12 and 15, if they get COVID, they either don't have symptoms or get it mildly. And, you know, that's the facts, and that's the reason why there is some debate, if you like, between scientists and professionals as to whether it should be recommended or not. Because for that child themselves, the risk of them getting seriously ill is low, but it's more about that knock-on impact that lots of children in school getting COVID can have, in terms of the disruption to their education and disruption to the things that they do outside school, and the disruption to the way that school operates, and all of that kind of thing. And for households who have lots of children and big families, the risk of it spreading to the rest of the household and things as well is also there.
Yeah, I think it's been a difficult one, because you've got the health implications and the JCVI making their recommendations, but obviously the government has got to look at the wide implications of anything that impact on everybody else's life as well.
Yeah, it's not easy at all.
It's not been. I just want to say thanks to H. Nelson, I think, who's just advising that it probably will just be children who've been consented that will be taken to a hall to have their vaccines. So I do find that there are so many concerns about, especially about the discordance in consent for families and their children. So
Yeah.
this, anybody who's here today, and if you have friends or family members who have chatted to you and talked about their concern with the vaccine, please ask them to go to YouTube and watch this if they're not here today, because we've had some really useful information. So that's I think it's important to put that to bed, because one of the things that I found with this, the whole pandemic, is there is a large swathe of information that is not absolutely correct.
Yeah.
This is borne out by sometimes concerns and underlying fears
Yeah,
about
absolutely.
things that are there. So that's really helpful. I don't have any further questions in the chat. Let me just have a make sure. Oh. So how do you know if your child hasn't already had COVID, but if they've shown no symptoms? Is there any way to do that test?
So at the moment, and if you're referring to the antibody test, which is a test that can show how immune you are to COVID, that's not something that's widely available at the moment. But all secondary school children are advised to regularly test themselves with that rapid test that you do at home. So that's one way of picking up if you've got COVID and you don't have any symptoms. It won't tell you about anything that happened in the past, but it's a way of your child checking regularly that they haven't got COVID in the here and now, even if they don't have any symptoms. And the reason why it's recommended that secondary school children do that is because they are more likely to have it without symptoms or with very, very mild symptoms at that age than older people who are more likely to get unwell with it. You know, even older people can get it without symptoms, but you're more likely to get very unwell if you're older. So that would be the main thing that I would recommend at the moment. There isn't a way really for most people of checking whether you had it in the past at the moment.
Okay. Well, Cordelle, this has been a really, really, really important session, and you've been really clear in your responses. I think they've been really helpful, and I hope that people who have dialed in today have found it helpful and have gone away with some additional information. So thank you very much. So I'm going to hand over to the Caribbean African Health team, somebody from the team.
Thank you, Dr. Cordelle, for such an amazing session. I feel like it's been very informative for everyone. And thank you for everyone for joining. I hope you guys found the session informative too, and that your questions about COVID-19 have been answered. So I'm just going to give a brief update about our upcoming events. So we have our annual flagship event, which is the Black History Month launch event, which will be happening on the 30th of September, and that's a Thursday, and that will be in person at the Manchester Cathedral from 6:30 to 9 p.m. So I'm just going to quickly share my screen to show everyone the promo video that we've done, and it just gives a brief insight into the BHM event and all the details you need to know about it.
CAHN's Black History Month event is almost here. This year we are back in person at the Manchester Cathedral. Our theme is Black Community Wealth Building, as CAHN wants to echo the importance of supporting Black businesses. Join us to celebrate the past successes of historical Black achievers. We have an exciting lineup for you: singing and dance performances, poetry, commemorations and plays, live guest speakers, food stalls and much, much more. Join us Thursday the 30th of September from 6:30 to 9 p.m. There are limited spaces at the venue, so book your place early for you and your loved ones.
So yeah, that's just a quick video encouraging you guys to book on, join with your family and friends, and we'd love to see most of you there. And coming up next week, we also have our regular weekly meeting. So that's Healthy Hearts, and that is 6 to 7 p.m. on Tuesdays. So yeah, so Healthy Hearts is, we have our nutritionist talk, and this week it'll be focusing on our new tailored support project. So if you're looking to improve your lifestyle habits, please join us. And then we're back on Saturday with our health hour again. And yeah, so thank you everyone for joining today, and I hope you have a lovely weekend.
Thank you. Bye.
Bye everyone.
Health Hour. Giving Black health advice. Get informed today to have a better, healthy tomorrow.